The next item of business is a debate on motion 17869 in the name of Jackie Baillie on addressing Scotland's medical and nursing workforce crisis. I would invite those members who would wish to speak in the debate, please press the request to speak buttons, and I call on Jackie Baillie to speak to and to move the motion. Up to 7 minutes, please.
Presiding officer, our NHS is on its knees. There are thousands of vacancies for doctors and nurses, and yet we are turning them away as posts lie unfilled, or even worse, posts are cut. When there are 860,000 Scots on a waiting list for tests or treatment, when delayed discharge remains stubbornly high, when GP numbers are reducing instead of increasing, and there are shortages in almost every area of the NHS, from nurses to allied health professionals, the fact that we are training people to end up unemployed is frankly a disgrace. It costs, no, I think you should listen. It costs £300,000 to train a single doctor up to landing a specialty training place. £300,000. But we are training nurses as well at a cost of £60,000. And we are throwing that down the drain. What a waste of taxpayers' money, but what a waste of their future. Now, the BMA has today published a survey of their resident doctors showing that a staggering 70% of them had concerns about their employment. All this while the vacancy rate for consultants is at 14.4%. Just to put that in context, that's 1,000 vacant consultant posts, enough to fill 2 large hospitals. It feels like a complete dead end, completely soul-crushing after 7 years of dedication. I do not know if I will be able to pay my rent come August, and if I'm unable to secure enough work, I will have to move back in with my parents. It's literally giving me sleepless nights. These are the voices of resident doctors who have trained for years, yet in today's Scotland are not able to get jobs. Some are considering moving to England or indeed moving abroad. Others are forced to choose between their family life and a job on the other side of the country. Others still are considering looking for a new career. This is the reality of what it's like to be a resident doctor in the SNP Scotland. For the individuals concerned, realising that the stable career they chose is anything but must be a crushing blow. But the SNP's failure to come up with a proper workforce plan is also a betrayal of all of us. As Susan, a resident doctor in Hamilton, asked, why are we spending money increasing university places for medical students when there are not enough jobs or training posts to continue their career in Scotland? And the Scots who can't get an appointment should rightly be outraged at the idea that they can't see a doctor when somewhere nearby there is an unemployed, qualified doctor sitting on their hands. As Douglas, a resident doctor, put it, I would love to be an anaesthetist. I would love to help bring down waiting lists, but I can't. The SNP government will say all the right things about how important NHS staff are, and they are, but it is their actions that betray them. I have today been sent information that shows that the SNP have cut the number of specialty training places for resident doctors in core surgical training, in general surgery, in neurosurgery, in ENT, in urology, in obstetrics, in paediatrics. And it is not just doctors. Because last year, the Royal College of Nursing Scotland warned that newly qualified nurses could not find jobs despite over 2,600 unfilled whole-time equivalent nursing and midwifery vacancies. Hundreds of them graduating without jobs to go to. One mother, whose daughter is about to graduate this year as a paediatric nurse, contacted me to say she and her fellow graduates could not find jobs in Scotland despite working on short-staff wards during their training. Her daughter is now preparing to move to Leicester. All this must be mind-boggling to the patients who are queuing at A&E or just waiting for a test, diagnosis or treatment. No wonder more and more people with means are going private because they can no longer cope with waiting in pain. Now, the SNP government say that it wants to fix our NHS. But you know something? After 18 years, if they had any idea of how to do so, we would have seen it by now. Now, we all know that our NHS is nothing without its staff. But instead of using them as a human shield, as this government does, the SNP must get its head out of the sand and take action. Because every month that the SNP drags its feet is another month where unemployed resident doctors don't know where to find the money for rent. It's another month for Australian headhunters to recruit them. It's another month that patients have to continue to wait for treatment. So this is why the Scottish Government has to act now. Not next year, but right now. It needs to provide jobs for these resident doctors this August, or risk losing them from the NHS completely. The Scottish Government needs to expedite its reported future medical workforce project and report back to Parliament by the 1st of September. But it must also undertake a wider review of workforce planning, with independent modelling and projections to report back by the 1st of December. Because it is urgent. There is a need to have a proper workforce plan, and these would be important first steps towards it. And frankly, we can't afford to wait any longer. So let me finish with another quote from a doctor surveyed by BMA Scotland. "My colleagues and patients love me. The feedback I get is great, but the system simply doesn't care. I am betrayed by the career and country I loved, and the worst part of it is, I know I'm not alone." This is Parliament's chance to speak up for the young, talented, hard-working people who have spent years training to work in our NHS, as doctors, as nurses, as allied health professionals, because they can't get a job. That is the fault of this government, nobody else. And this is the time for ministers to commit to changing the system so that qualified doctors and nurses can do the jobs they trained for. Thank you.
Thank you, Ms Baillie. And can I just check, Ms Baillie, that you moved to your motion?
I move.
Thank you. And I now call on Cabinet Secretary Neil Gray to speak to and move Amendment 17869.2. Up to 5 minutes, please.
Thank you, President Officer. I move the amendment in my name. In this chamber, I have always been candid about the challenges our NHS faces, and today will be no different. I want to start by once again putting on record my deep appreciation for all the hard-working staff without whom our NHS simply could not function. In the case of our Agenda for Change staff, I was delighted to be able to recognise their efforts through the recent agreement on a 2-year pay deal, which will feed through into payslips later this month. We continue to invest heavily in our workforce, with the latest NHS Scotland workforce statistics showing that were published last week, demonstrating 13 consecutive years of growth. There were also other causes for optimism in those statistics, most notably the 62% reduction in nurse agency staffing achieved over the course of 24-25. And through our ongoing work to implement the recommendations from the Nursing and Midwifery Task Force, we will take further action designed to both attract and retain our nursing workforce, listening to the feedback we have gleaned directly through conversations with staff on the ground. I note Jackie Baillie's concern around newly qualified nurses who are unable to secure posts. I'm aware that there was a limited number of newly qualified children's nurses and midwives who had challenges in identifying suitable posts in their local area last year. My understanding is that there are often vacancies available across nursing disciplines, and that geography can also be a factor impacting fill rates. Indeed, latest statistics indicate historically high levels of nursing and midwifery staff, and also over 1,000 Band 5 nursing and midwifery vacancies across Scotland, which are open to newly qualified practitioners. I am also aware of similar reports of resident doctors. I will give way.
Sanjay Gohani.
Thank you for giving way. I wonder how many paediatric nurses have vacancies to be able to take up a job from being newly qualified.
Cabinet Secretary.
As I said, I was aware of a limited number on a geographical basis that did find that a struggle, but there are, as I've just said, a wide range of vacancies available for newly qualified nurses to go into. I am also aware of similar reports of resident doctors having difficulty securing specialty training places, and these have been parts of the discussions that we've had with the workforce, that the First Minister and wider partners have been part of. That specialty training places, I'm sure Jackie Baillie is aware, are recruited on a UK-wide basis and then allocated based on where the greatest service needs lie. And entry to specialist training is through a competitive application process run on a 4 nations basis. Contrary to Jackie Baillie's assertion in the speech, we have funded the creation of hundreds of additional specialty training posts across all specialties, including 47 added in 2025. So we are ensuring that we are training the number of consultants we need for the future, which is why we have funded the creation of hundreds hundreds of additional posts across specialties. I recognise the calls for greater workforce planning to account for what patients and the public want from their health service, and importantly, to ensure that medical careers remain attractive. That is why the Scottish Government is taking forward the work that Jackie Baillie mentions in her motion, to think ahead to the 15 and 20 years into the future and to gain an understanding of the needs of the future medical workforce. I wonder if I might be able to get the time back, President Officer.
A very limited time. Brian Whittle.
Briefly.
Okay, I really appreciate the Cabinet Secretary giving way. A genuine question. When my daughter qualified as a midwife, there was 10 times as many applications as there were places. Now, for midwifery, they're going through the clearinghouse in university. Does that cause the government any concern?
Cabinet Secretary.
So I recognise that there are areas within our health service that are particularly attractive for people to move into. I recognise paramedicine, midwifery, paediatric nursing. We want to make sure that we can ensure that those that are coming through training are being married to those positions that are available on a wider geographical basis, and make sure that we have the staff in the areas that we need in order to respond across the country. The work that is underway to consider the future needs of the medical workforce will consider questions like what the role of a doctor will be, what will look different for doctors and how they deliver care, and importantly, what are the steps we need to take now in order to deliver against that. The project is welcomed by doctors at all stages of their careers, NHS employers, the Royal Colleges and the BMA. Listening and dialogue will be key, and all doctors will have an opportunity to contribute their views. And in order to do this well, it cannot be rushed. That's why the report on this conversation will be published by the end of this year, alongside our assessment of the demand for medical services and the possible future supply of the medical workforce. Consultation on any policy changes will need to be made also informed by the outcomes of the NHS England review of postgraduate training, which has an impact, as there are benefits to all 4 nations for some of our systems and processes to be developed in lockstep, and that consultation will take place in 2026. Of course, even with continued effort and investment to grow and support our NHS Scotland workforce, the system can only function effectively if it is operating as part of an integrated health and social care system. I therefore cannot let this opportunity pass without highlighting my significant and grave concern about the recently published UK Government White Paper on immigration and the Labour Government's intention to close the social care visa to new applications from abroad, the implications of which will be catastrophic for our social care sector and will undoubtedly have an impact on
Cabinet Secretary, I have been generous, but you will need to conclude.
On the entire system. So to conclude, Presiding Officer, there is a vast amount of work underway, both from a workforce perspective and from a reform and renewal perspective. The Population Health Framework, Service Renewal Framework, which will be published soon, will build on these initial steps, setting the trajectory for the years ahead and demonstrating the ambition that we have for the NHS in Scotland. I look forward to working with the workforce as we seek to implement these new ways of working for the benefit of our patients and staff across the country.
Thank you. I now call on Sandesh Gohani to speak to and to move Amendment 17869.1. Up to 4 minutes, please.
Thank you, Deputy Presiding Officer. And a declaration of interest as a practising NHS GP and a former chair of the GP Trainees Committee in the BMA. From my experience in GP surgery, I see not statistics, but real-life stories. And they tell me our workforce is stretched to breaking point. For behind every delayed scan or missed appointment is a patient left in pain, desperately worried, and a clinician left exhausted. Let's call this what it is. It's a workforce crisis created in Bute House and presided over by a revolving door of SNP health secretaries who have failed to plan, failed to lead, and failed Scotland's patients. And the consequences of these failures, we have junior doctors now finishing years of training only to find no jobs. We see GPs being trained in Scotland and forced to leave Scotland to work. The SNP training doctors for Australia. And newly qualified nurses and paramedics are joining the ranks of unemployed, all at a time when patients are struggling to get seen. This is happening right now, outside this chamber, in the real world. The Royal College of Radiologists laid bare the scale of the crisis. Scotland faces a 25% shortfall in radiologists and a 19% shortfall in clinical oncologists, the highest in the UK. By 2029, those shortfalls are projected to grow to 35% and 31% respectively. So what does this mean for everyone out there, all our patients? Well, it means longer wait times for cancer diagnosis, delayed treatments and worsening outcomes, and in some parts of Scotland, the gaps are even more severe, deepening regional inequality. This is truly scary The Scottish Government needs to get a grip and stop trotting out the kind of platitudes we see in the SNP amendment. But, Deputy Presiding Officer, the problem extends beyond cancer care. In cardiology, over 6,000 patients have been waiting more than a year for an echocardiogram, and this is a vital test for heart disease, but not according to the SNP. No, shockingly, the Scottish Government doesn't consider this one of its key diagnostic tests. It's omitted from workforce planning, from routine reporting, and from serious political attention. After 18 years in government, the SNP still hasn't got its head around the basics. The waiting list for this test is now more than double the combined total of the 8 key tests that this government does track. The cause of this, of patients with suspected heart disease, is having to wait, and it's clear. There is a lack of trained cardiac psychologists and physiologists, and wait, the only degree programme in Scotland for this specialty is ending, and there's no replacement in place for 2025. A profession crucial to saving lives is being allowed to wither from neglect, and that is the SNP in a nutshell. Now, let's turn to GP. What I witness is not isolated strain. It's the visible symptom of deeper workforce crisis the SNP has long ignored. Poor planning, a lack of vision and political complacency have left our NHS hollowed out, even as demand continues to soar. Announcement versus reality. The SNP promised 800 more GPs by 2027, but lo and behold, GP numbers have instead fallen from 4,514 in 2022 to 4,438 as of last year. The BMA and RCGP have warned general practice is in danger of collapse, and yet, under the slick management of the SNP, we find ourselves in the absurd position where we are having underemployed doctors, and yet demand is soaring. It's time for change, not in slogans nor excuses, but in leadership. Our NHS staff and our patients deserve better, and I move the motion in my name.
Thank you, Dr Mahoney. Excuse me, and I now call on Lorna Slater. Up to 4 minutes, please.
Thank you, Presiding Officer. Every person in Scotland, as well as every person across this chamber, recognises the challenges that our NHS is facing. We are, of course, fortunate to still have a fully public NHS in Scotland. Scotland has taken a very different approach to NHS reform compared to England, especially since devolution. Whilst NHS England underwent market-oriented reforms, starting with Tony Blair in the 90s and following up with the Conservative Health and Social Care Act of 2012, Scotland focused on integration and collaboration, not competition. Maintaining a fully public NHS, while Scotland's purse strings are held by a government in London who prefers a market-driven, profit-driven model, is one of the many frustrations that I have with the current devolution settlement. There is a limit to what Scotland can do from here, where we sit in this unequal union. Scotland... Yes, very quickly, I've only 4 minutes.
I thank the member for taking that intervention, but will she also acknowledge that hundreds of her constituents are today going private because they cannot get appointments on the NHS in Scotland?
Lorna Slater.
I don't disagree that there is a crisis in NHS Scotland, which I'm coming to, but the member will also acknowledge that many of the problems we face in Scotland are made in Westminster. The persecution of asylum seekers, not allowing them to work, takes valuable people out of our workforce, for example. The persecution of immigrants and the hostility to people who come here. I will get to these points. Scotland does have a crisis, as the member says, in our medical and nursing workforces. Everyone is aware of this. We are all aware of the absurd rigmarole we go through when trying to get a GP appointment, having to call over and over at 8 a.m. or at 2 p.m. to get through. We've all done that. Quite a challenge to anyone who has any sort of job or daytime responsibilities. Increasing the number and availabilities of GPs and expanding and enhancing general practice facilities and premises must be an urgent priority. There are some things we need our governments to do to help fix this. We need the UK government to let up its hostility to foreigners and to immigration. 40% of GP trainees across the UK are international medical graduates. And the Labour government in Westminster should offer all of them indefinite leave to remain upon successful completion of GP speciality training. The Royal College of General Practitioners of Scotland agrees with me. The Scottish Government could help by creating a national umbrella body capable of sponsoring IMG visas to remove the bureaucracy and costs from GP practices. Of course, the UK Home Office could remove that at a stroke of a pen, but anyway, here we are. The UK Government should rethink its unworkable fiscal rules, commit to taxation of the most wealthy and of polluting industries, and reverse the increase to the ENICS contributions, which were its only options after making self-harming promises of on taxation during their election campaign. There is a great deal of anxiety amongst GPs about the risk of underemployment due to constrained practice finances. The recent increase in employers' national insurance contributions has led many GP practices freezing or scaling back their recruitment plans. The Scottish Government must work to deliver the Future Medical Workforce Project urgently and to complete the implementation of the Nursing and Midwifery Task Force as soon as possible. The Scottish Government must increase the general practice workforce and, just as importantly, the capital investment into general practice premises to expand and enhance facilities and infrastructure. The Royal College of General Practitioners 2022 survey has found that 62% of respondents considered that their premises were not fit for purpose, with issues such as a lack of consulting rooms. We see this in East Calder, where my Lothian region colleagues Sarah Boyack and Faisal Chowdhury have led the campaign to expand the local health centre. The East Calder Health Centre was originally built for 4,000 patients and now serves up to 16,000 as the towns and villages in the area have expanded rapidly, leading to challenges for both medical staff and patients trying to access those services. The lack of investment into infrastructure has left patients and staff in limbo. GP surgeries are only one aspect of the health service, but they play a crucial role at the front line and in preventative care. To help them, if we help them, we help unburden our emergency rooms and our hospitals as well.
Thank you. I now call Alex Cole-Hamilton. Up to 4 minutes, Mr Cole-Hamilton.
Thank you very much, Presiding Officer. I am pleased to speak today. Although I'm tired of saying that this is a crisis, we do it repeatedly. It is a crisis. That fact is self-evident to those who work in it, in the NHS, and those who rely on it. It's plain to see in waiting times, in hospital pressures, and in the very workforce our system depends on. Let's be absolutely clear at the outset. This is a crisis caused by years of complacency by this SNP government, which has now been in power for almost 2 decades. 1 in 6 Scots on a waiting list. People forced to go private for healthcare, not in choice but in desperation, and patients waiting weeks just to get an appointment to see their GP. Not a week goes by, and I'm sure I'm not alone in this chamber, when I get a constituent visiting with me or getting in touch to tell me the impact this is having on them or someone that they love. Now let's turn to the workforce. We've got over 2,500 unfilled nursing and midwifery vacancies, but newly qualified nurses are still struggling to find work. How can that be? How can that be when in this chamber we passed legislation to ensure that our nurses should never go to a shift that was not safely staffed, yet none of them report confidence in the safety of the shifts that they are asked to staff. We've got residents, doctors, unable to get onto speciality training programmes despite investing years of study and service in our NHS. That's not just a tragic waste of talent, it's an insult to those waiting for placements, but also for those staff and patients who desperately need their expertise on the front lines. What is the point in increasing training places without ensuring jobs exist at the other end? There's no proper bridge, Presiding Officer, between training and practice, and the few bridges that do exist are now bottlenecked, leaving exhausted senior clinicians to oversee more trainees with yet fewer resources. I've spoken with experienced locum doctors in my constituency. They have told me that they cannot find work in Edinburgh, in our capital city, where demand for health care, for primary care, has never been higher. That's how broken this system is. Patients are crying out for care, yet qualified clinicians are left on the sideline because GP practice budgets are so stretched they cannot reach for the luxury of sickness cover. This isn't just mismanagement, it's a direct result of a government that has failed to take responsibility for national workforce planning. They have pushed responsibility onto local boards without the tools of long-term modelling to deliver. It's clear the government's Future Medical Workforce Project is not working. While there are issues with the government's 2018 contract that expected GPs to work on a multidisciplinary model, I'm afraid I must make progress. And the demand for GP appointments has gone up significantly since then. Presiding Officer, the NHS does not need more pilot schemes. It needs action, genuine change. It needs conversations, difficult conversations, innovation and reform. Presiding Officer, the UK's decision, one aspect of the government's amendment I do agree with is that the UK's decision to close health and social care work visa route to adult social care was short-sighted, deeply damaging. It risked worsening an already acute crisis in staffing in our NHS and social care network workforce. But let's be absolutely clear, the recruitment and retention crisis that we have in Scotland's care sector has been years in the making as entirely of the SNP's own design. It is driven by low pay, by poor workforce planning, and a Scottish Government that consistently fails to value those on the front lines. But here in Scotland, we can only achieve change if this Government chooses to act. They must match our ambition. They must give care workers the pay and recognition they deserve. And at Westminster, we're calling for an end to crippling Home Office visa fees that threaten to push services to the brink. Our message is simple. Whether care workers grew up here or came here, they deserve fair pay, job security and respect. To conclude, Presiding Officer, Government needs to stop dragging its heels and act before this crisis deepens.
Thank you. We now move to the open debate. I call first Carol Mochan, to be followed by Christine Graham. Up to 4 minutes. Ms Mochan.
Thank you. I am pleased to contribute to today's debate and to speak on an issue which concerns the very backbone of our NHS, its workforce. Let me begin by echoing other members' points about the value of our NHS workforce. It is the very beating heart of the NHS, and without it, services and care would simply collapse. And this is why it is so important we discuss this matter openly and honestly in this place. I want to extend my thanks to all of those working tirelessly in Scotland's NHS. Scottish Labour recognises the contribution and value of workers and understands the pressure and strain they face on a daily basis. When speaking to constituents, one of the many things I hear is how difficult it is to see a local GP, or how long NHS waiting lists are. Ambulances are stacked up outside A&E, patients are waiting hours for treatment, and those ready to be discharged are forced to remain in hospital whilst waiting for appropriate care packages. Everything has stagnated. But let's be clear, people understand this is not the fault of the staff. In fact, people speak very highly of the staff. It is the system, and this responsibility lies with the government. At the centre of this government's stagnation is our workforce, who are struggling to keep up with demand and a fundamentally broken system. After 18 years in power, the SNP has presided over a workforce crisis where staff shortages not only risk patient safety, but also put additional pressure on the existing workforce, impacting both their mental and physical health. At a time when our healthcare system is crying out for additional staff, newly trained doctors and nurses who are highly motivated and ready to serve are met with disappointment when they are told that after years of training there are no jobs, which we know is not true. The system is crying out for highly professional, trained staff. If we want safe staffing, we know the NHS must fill more posts, and this government knows it. How can it be right that newly qualified nurses are being forced to find jobs outside of Scotland despite completing their training at Scottish universities and Scottish hospitals where they see the pressures day in, day out? We know there are currently over 2,600 unfilled whole-time equivalent nursing and midwifery vacancies. And we hear from nurses daily that it is agonising to go through and complete the recruitment process within the NHS at the moment. And since 2013, there have been a 28% decrease in the number of registered nurses employed in care homes. Now, this is an important issue. We know that these nurses contribute greatly to keeping hospital admissions down, so we must take these statistics seriously. Delivering and supporting a sustainable nursing workforce across Scotland is crucial to improving overall patient care and experience. Yet our nurses are reporting feeling undervalued and overlooked. When it comes to issues such as corridor care, poor planning has left staff feeling ashamed, demoralised and distraught. Our NHS workforce deserve better, and things cannot continue as they are. The Government are aware that urgent work is needed to attract and retain a sustainable workforce, yet there is no obvious plan. There is a disconnect between what the Government promises to do and what it actually delivers. Delivery is essential. I hope members will support Labour's motion today, which recognises...
Members just concluding. Members just concluding.
Apologies. I hope members will support Labour's motion today, which recognises the ongoing workforce crisis and calls on Government to undertake a wider review of NHS workforce planning, which must be reported on by the end of the year. Our NHS workers and patients deserve better. Presiding Officer, the status quo of this Government is no longer an option, and Scottish Labour are ready to deliver the whole-scale change our NHS needs and deserves. Thank you, Presiding Officer.
Thank you, Ms Mochan. And I call Christine Graham to be followed by Monica Lennon. Up to 4 minutes, Ms Graham.
Thank you, Deputy Presiding Officer. First of all, I do not accept that the NHS in Scotland is in crisis. It even avoided crisis at the very height of the COVID pandemic, due in the main to its extraordinary staff. It is in challenging circumstances, yes, but to say it's in crisis is scaremongering, not that Labour is known for that. Indeed, if it were in crisis, you would have thought Labour would have assigned all of its debating time to the NHS instead of this very, very short debate. So, in the paltry 4 minutes that I now have to make the following points, I'll try my best. Pressures. COVID continues to impact, and University of Strathclyde research states, quotes, "The challenges facing the NHS in Scotland are not unique and reflect broader global trends within healthcare systems." Demographics. Ageing population in 2020, there were an estimated 1 million Scotland residents aged 65 years or older. By 2040, this will rise to an estimated 1.4 million, 25% of our population. I'm one of those. As we age, we require to use our medical services more and more. GP, pharmacy, hospital. At 80, I can testify that. And it also means a depleted available workforce. Interventions. The Scottish Child Payment supports over 326,000 families, costing £1 billion since 2021, mitigating the Labour two-child benefit cap. Poverty equals disadvantage equals ill health. There are many Scotland-only preventative measures reducing in time the pressures on our healthcare system. That's why the U-turn by Labour UK and the winter fuel payment, shamed into this by pensioners and the Scottish Government, is welcomed before another Scottish winter hits home and hearth. Pity we can't shame Labour into ditching the two-child benefit cap. 4 minutes? Of course not. Staffing, fewer people in the working population, yet UK restrictions on visas, the impact of Brexit, increased Labour employers' national insurance contributions, costing NHS Scotland an additional £191 million in one financial year, all impacting on staffing pressures across the entire health landscape, including GP practices and pharmacists, which I know are not recruiting because of that added NI burden, that tax on jobs. Pay and conditions. NHS nurses, midwives, paramedics and other healthcare staff across Scotland have voted to accept an 8% pay deal over 2 years. The Scottish deal is significantly higher than the 3% recommended by peer review bodies in England and Wales, where pay negotiations are continuing and striking action is a real threat. The role of hospital at home. Reducing time in hospital with better recovery. All of these interventions, preventative measures, modern ways of treating will reduce and are reducing in time pressures across our healthcare landscape. So we need a wider review, given the value and the cost of the interventions to reduce these health pressures. We need to look, and the Labour Party has to be honest about the impact of labour gaps exacerbated by Brexit, which now, of course, Sir Keir Starmer is embracing. He used to oppose it. Visa restrictions, those dreadful employer national insurance burdens, all of them UK policies, all of them Labour policies, to which I have alluded in this very short debate, which, as I anticipated, is only chasing tabloid headlines. It's got nothing to do with reality.
Thank you. I now call Monica Lennon to be followed by Finlay Carson. Up to 4 minutes, Ms Lennon.
Thank you, Presiding Officer. In securing this debate, Scottish Labour is confronting the crisis gripping the NHS in Scotland. A crisis that is not simply measured in statistics, but is felt in the lives of patients, nurses, doctors and families across our nation. We heard it clearly on the doorsteps and on the streets of Hamilton, Larkhall and Stonehouse during the recent by-election. And I want to congratulate David Russell, Scottish Labour's winning candidate. And I know he's already working hard to represent his constituents in Hamilton, Larkhall and Stonehouse. And frankly, they, like people across Scotland, are sick of the excuses. This is the Scottish Parliament. I know there are very few SNP MPs left in the House of Commons, but that is the place to hold the UK Government to account. This is the Scottish Parliament. The NHS is devolved, and unlike the Greens, we will not let the SNP off the hook any longer, because as you heard the emotion in Jackie Baillie's voice, this is personal to every single one of us. We care about the staff, we care about our constituents, and we're not going to put up with complacency, and I will take the intervention.
Will the Labour government,
briefly.
Thank you. Will the Labour government be changing its policies on allowing asylum seekers to work and on hostility to immigrants to support the NHS in Scotland?
Through the chair, Monica Lennon.
What I will say to Lorna Slater, she's made some relevant, important points as that of her contribution, but what she's failing to do is to address the purpose of this motion today, which is to take this opportunity in the chamber to hold this government to account for its broken promises. Hold on a second, because I heard the Cabinet Secretary say, I hear the calls for workforce planning. I have been here for 9 years, and for even longer than that, the whole of the 18 years of this government, we've been calling for better workforce planning. Why can't this government do its job?
Cabinet Secretary brief.
in our amendment we set out the timescale for where that's going to be delivered. But I really resent, and Monica Lynn is better than this, to suggest that somehow that SNP ministers do not care or have the same care for our health service that brought my 4 children into this world, that saved the lives and improved the lives of my family members as well as everybody else across the chamber. I think we need a little bit more cross-party consensus as to our conjoint support for the health service, as opposed to what Monica Lynn has just suggested.
Monica Lynn,
I'm not going to take the patronising comments or the emotional blackmail from the Cabinet Secretary, because no one is doubting what's in his heart and his compassion, but it's about competence. Why has there been no proper workforce planning? That's what people were asking in the by-election, and that's what they're asking as we face the polls next year. I will admit I've got some skin in the game. My daughter today has successfully completed her first year as a medical student. My son-in-law is a resident doctor. We're not making these things up. You know, people are coming into the healthcare profession because they care, but the opportunities are not there. And that is the reality. So he can chunter away all he likes, but we need to get solutions. And lastly, with the few seconds that I have left, one of the things that we heard clearly on the doorsteps in the by-election is that people are not going to stand for this government downgrading Wishaw's neonatal unit. That's why Davy Russell was elected. The staff have been ignored. The families have been ignored. The Cabinet Secretary can shake his head. I will take any intervention he wishes to make. But that is an absolute denial of an award-winning service for the most vulnerable and the sickest and the smallest babies in the country. Babies in Lanarkshire should not be getting sent away to Aberdeen for critical care at the most vulnerable time in their life. So that is the reality. That's not a UK government problem. That is the responsibility of this government, and we're not going to apologise for bringing these arguments to the chamber.
Thank you. Before calling the next speaker, I would encourage the front benches not to be carrying on a discourse while the member is on their feet. I now call Finlay Carson, to be followed by Emma Harper, up to 4 minutes.
Thank you, Presiding Officer. How many times have we sat in this chamber and listened to successive health secretaries assure us that Scotland's NHS is safe in their hands? Now we hear the First Minister making similar promises, claiming that under his leadership things will be different and that the NHS will be a priority in the coming months. Really? Well, let's not forget this out-of-touch SNP administration has been in charge for nearly 2 decades, and yet our health service continues to lurch from one crisis to the next. That alone speaks volumes about their abject failure to address the workforce crisis, the cause of our problems. Yes, the pandemic added pressure, but the truth is Scotland's workforce planning was in disarray long before COVID. Despite repeated promises to bolster frontline support and staffing, the reality is stark. It simply isn't happening. I know it, you know it, and the public certainly knows it. Knock on any door in my constituency of Galloway and Western Fleece and you'll hear the same concerns: a lack of GP appointments, a shortage of NHS dentists and long waits for hospital treatment. These are not isolated issues, they are systemic failures across Scotland. And now we face a paradox that lays bare the dysfunction at the heart of this government's workforce strategy. We have underemployed GPs unable to find sufficient work despite widespread vacancies. We have newly qualified paramedics and paediatric nurses struggling to secure roles even as vacancies remain unfilled. The SNP promised to increase GP numbers by 800 by 2027, but that target is slipping further out of reach as GP numbers decline and junior doctors struggle to find jobs. The Royal College of Nursing has made it clear that current staffing levels are inadequate. Yes, the number of nurses employed by the NHS Scotland has increased, but so too have staff absences and reliance on costly agency workers. This is not sustainable. It's a sticking plaster on a gaping wound. The Nursing Workforce in Scotland 2025 report shows that demand is outstripping supply. We urgently need better data and more robust planning to ensure a sustainable workforce for the future. Without it, we're simply guessing, and guessing wrong. Meanwhile, the Scottish Government's plans to deliver 100,000 extra GP appointments has been criticised by the Royal College of General Practitioners because the workforce simply isn't there to deliver it. It's headline-grabbing promises with no substance behind it. In my constituency, the consequences are painfully clear. Mothers in Wigtonshire still having to face a journey of over 1.5 hours along the treacherous A75 to give birth in Dumfries, despite the presence of a fully equipped maternity unit at the Galloway Community Hospital in Stranraer. Why? Because NHS Dumfries and Galloway lacks the resources to staff it. That's not just inconvenient, it's dangerous. The same goes for care beds. The local integrated joint board promised 31 flexible beds instead of reopening 4 cottage hospitals, something the community overwhelmingly supported. The number has been paused at just 22 beds, and I've not even reached that, as they try to manage a £14 million overspend. This government continues to ignore the unique needs of rural areas like mine, which is one of the largest ageing populations in the UK. And let's not forget the human cost. One of my constituents has been told he must wait 52 weeks just for a cataract appointment, far beyond the 12 weeks target. He was suggested he should take private treatment for £3,000, but he just can't afford it, and now his job is at risk. This is not just a statistic, it's someone's livelihood, someone's future. Despite the tireless efforts of health and care staff, they're stretched to breaking point. It's a tragic irony. Waiting lists in Dumfries and Galloway are at record highs, with just 31% of patients being seen within 12 weeks and a staggering 763 waiting longer than 1 year and 10 more than 2. Presiding officer, Scotland's NHS is not just under pressure, it's on life support. We need immediate, decisive action to address this workforce crisis. We need a government that listens to the professionals, that plans for the future and that delivers on its promises. The people of Scotland deserve better, and it's time this government delivered.
Thank you. We now move to the final speaker in the open debate, Emma Harper. Up to 4 minutes, please.
Thank you, Presiding Officer. The group leader of the Labour Party told this chamber 2 weeks ago, and Jackie Baillie just said it in her opening, that there are now 860,925 people on an NHS waiting list. But as Public Health Scotland, who I assume the opposition parties understand does not work for the SNP and is politically utterly impartial, themselves say figures for the number of ongoing waits of patients waiting should not be added together to determine the proportion of the total population waiting. Mr Sarwar and his allies in the other parties were caught out last year when the Full Fact organisation said about his misuse of statistics, and I quote, "Politicians and the media must take care to use the best evidence available and describe it accurately so that people are not misled about the state of public services." And I couldn't agree more, Presiding Officer. If they can't even get the basic facts of the attack lines right, why would anyone trust a word they have to say about our health service?
Ms Harper, Ms Harper, can I ask you to resume your seat? Can you please spare me the back and forth, not just the front benches? You've now encouraged the back benches to join in as well. Ms Harper, I can give you the time back.
Thank you, Presiding Officer. So, if they can't even get the attack lines right, why would we trust them to get a word in on our health services? No one here in our national parliament has denied the scale of the challenges facing our national health service. And I know this with my background as an NHS nurse and former employee of NHS Dumfries and Galloway, with friends and connections who tell me what's going on the ground. And I want to thank everyone who commits their time and effort and the amazing professional care that they provide to patients every day. But I believe the Scottish Government has taken step after step, not just in our post-COVID world with all the additional challenges that has been added to our health systems, but over the years before, to get our NHS working at full efficiency. Scotland offers the highest nursing, midwifery and paramedic bursaries anywhere on these isles, and non-means tested £10,000 a year here, while England offers just half that. Our NHS provides the highest pay out of any of the 4 UK systems, a state of affairs reflected in the vote to accept the Agenda for Change pay deal earlier this year. Scotland has also led the way in the training of physician associates and anaesthesia associates in our NHS, increasing capacity for assessment and treatment and working with medical schools to ensure the training and education is in place to continue that programme in the future. As MSP for the South, I am acutely aware of the particular challenges our health service faces in rural areas. That is why the uniquely Scottish ScotGem programme is particularly welcome, bringing graduates training up to a postgraduate medical degree to NHS Dumfries and Galloway to help provide rural care in our part of Scotland. It's always interesting, Presiding Officer, how I am the only person that's bigging up ScotGem and its success, and the Cabinet Secretary and I have talked about it before. It's always interesting how the opposition doesn't want to tell the good news stories. And again, the SNP is putting resources and money where it's needed, with bursaries funded for those who come to work in our rural communities. This is a government that is acting when action is needed. And what is more, Presiding Officer, we are committed to the public health service that remains free and with medical needs, and that's the most important thing. If it's for Labour to explain why their Health Secretary down south has taken over £370,000 in donations from profit-making private health businesses over the last decade. But we are clear that our NHS will remain publicly owned and publicly accountable. I don't doubt that Labour are genuine in wanting a better National Health Service. I doubt there are many elsewhere in the country who do not, but their words aren't matched by deeds, and their attempts at weaponising this multiplicity of challenges our NHS faces for electoral ends is an attempt to pull the wool over Scotland's eyes. Thank you.
Thank you, Ms Harper. We move to the closing speeches. I am disappointed to note that Mr Cole-Hamilton is not in his seat. I will expect an explanation and an apology. I call Brian Whittle up to 4 minutes. Mr Whittle.
Thank you very much, Deputy Presiding Officer. Workforce planning, Deputy Presiding Officer, I feel that we're stuck in a time loop. For all the time I've been in this place, as Monica Lennon pointed out, it seems we've been asking for some kind of credible workforce plan. And by credible, I mean one that actually addresses a need. Back in 2017, the then Cabinet Secretary Jean Freeman decided that the Scottish Government would train an extra 800 GPs over a 10-year period to address a shortfall of 860 GPs. Now, the mathematicians among you may already see the flaw in this plan. However, as Audit Scotland pointed out, by the time these 800 new GPs are trained, some of the existing workforce will have retired. Now, who could have foreseen that? Which leaves an estimated deficit of 664 GPs in 2027. Of course, it's got progressively worse than that because the Scottish Government are very keen to count numbers of GPs as opposed to the real-time equivalent, which paints a really different picture in primary care. And the very same applies to our stretched nurse and midwifery departments. Burnout is a phrase that is increasingly used as more and more of our NH staff are either retiring early or off sick with stress. And the Scottish Government often puff out their chests and tell us about the record investment in the NHS of record numbers of nurses and doctors and midwives and consultants. Then when we challenge them with the reality of record waiting lists, of record vacancies, of growing ill health that just continues to grow, all of a sudden the words Westminster and Brexit and pandemic or anything other than SAP responsibility, Presiding Officer, both positions cannot be true. The truth is the response from the Scottish Government is akin to trying to fill the proverbial bucket with holes in it. Retention should be first, Presiding Officer, recognising the issues facing our GPs and nursing staff and creating an environment that encourages them to stay and, crucially, encourages more to take up these positions. And that's a position an approach I've pushed ever since I arrived here. Incidentally, Presiding Officer, I think something the Scottish Government could do right now is reintroduce nursing and midwifery apprenticeships as an alternative route into the profession, because more than 40% of midwife students are over the age of 30 and will probably have had to give up a career to pursue this career. We should be making it easier for them to access these positions. I will take a very brief intervention.
Cabinet Secretary. I refer Mr Whittle to the Nursing and Midwifery Task Force, which is looking to implement alternative routes into nursing and midwifery training.
Brian Whittle, give you the time back.
I do appreciate that, yes. But that brings me to the way to tackle the pressures put in our healthcare system, and specifically our GPs and nurses. There are two elements to dealing with the pressure on hospitals and our GP surgeries. That is increasing headcount and, crucially, reducing the need. But all I've ever heard from the Scottish Government is about increasing the headcount of record numbers per head of population. There is a reason for that need. Rurality of Scotland is one of these, but the poor health of our nation is the huge elephant in the room. We have high levels of economically inactive people through ill health, with an alarming rise in poor mental health. If you focus only on increasing the headcount, you will forever need to increase the headcount. Preventable health has been the poor relation in this equation. Finally, deployment of a technology-agnostic interoperable solution is absolutely essential if we are serious in bringing our NHS into the 21st century, which apparently the Minister for Public Health and her team didn't understand and decided to Google the meaning, because apparently that's now how the Scottish Government are now deciding policy, and was confused by the answer. Now, I thought I would Google it, and here's what I got, and I quote: "A technology-agnostic interoperable solution is one that can work with various technologies and systems, allowing for flexibility and integration without being tied to a specific vendor or platform. This approach promotes interoperability, scalability and future-proofing, enabling businesses to adapt to evolving needs without being constrained by a single technology or vendor." If I was cynical, Presiding Officer, I would suggest the Minister was trying to avoid scrutiny. This is not a serious government, Presiding Officer. It has no idea how to deal with the issues we are debating today, and while they remain in office, the health of our nation and the support needed for our NHS will continue to slide. Deputy Presiding Officer.
Thank you. I now call the Cabinet Secretary up to 5 minutes, please.
Thank you, Presiding Officer, and to colleagues across the Chamber for participating in this debate. I'm grateful for everybody for their contributions. It is disappointing the way it has been conducted at times, but I want to close In a more consensual manner, Presiding Officer, as you know me well, I like to bring people together. I didn't have time in my opening remarks to reflect on the immediate work that we are taking forward to make improvements in the performance of NHS Scotland through the Operational Improvement Plan and the investment they are making to reduce waiting times, to reduce accident emergency waits and to increase access to the NHS. These will undoubtedly benefit those in need of care and treatment, but importantly, crucially, for the terms of this debate, they will also ultimately alleviate the pressure and support the well-being of our NHS Scotland workforce, who are, of course, the key focus of today's discussion. The greatest gift that we can all give is to see that service improvement happening and the reduction of waiting times, and also, if I'm candid, the potential for moral injury that I think colleagues have reflected upon for our staff in not being able to respond in the way that they would wish. We owe it to them to drive improvements and set the system up for future success, and that, I can guarantee to colleagues, is my top priority. I also used my opening remarks to touch on our plans to bring forward our population health and service renewal frameworks in the very near future. The contributions which I have heard today have reinforced to me the importance of the changes to be enacted as a result of both frameworks. And when I talk about renewal, I'm not just talking about systems or plans changing for patients. I'm clear that the changes must also deliver for staff. Scotland faces serious and growing health challenges. I will, of course, take an intervention.
Jackie Baillie. I am grateful to the Cabinet Secretary. Can I ask him what can he do for junior doctors this August, because they're facing not having jobs this August?
Cabinet Secretary.
Funding is in place for local boards to make employment decisions. That is for them to do, and we will continue to work with the BMA on these points. Indeed, I'm meeting with the BMA Resident Doctors Committee very soon in order to discuss some of these points. As I met with the Royal College of GPs to reference some of Sandesh Gulhani's points, and meet with the BMA General Practice Committee tomorrow morning, met with the Consultants Committee and the representatives from the Specialty Doctors Committee today. So these are discussions that are ongoing. Scotland does face, this is picked up by a number of colleagues, serious and growing health challenges. More people are expected to be affected by disease in years to come, and too many lives are still cut short by poverty and inequality. Addressing these challenges isn't solely the task of those working in acute and community health settings. Instead, we need to shift our focus from treating illness to preventing it. By taking this approach, we can reduce the burden on our healthcare system and the staff who operate it. So alongside the Population Health Framework, we will also be publishing the Service Renewal Framework, our long-term plan to reshape health and social care services. The framework is shaped by 5 key principles. First, prevention, focusing on early intervention and reducing the burden of disease. People, designing care around individuals, not systems. Community, shifting more care closer to home. Population, planning services based on real population needs, not organisational boundaries. And finally, digital, using technology to improve access, coordination and outcomes. I believe, if I've still got time, Presiding Officer, of course I'll give
Yeah, I'm very grateful for the Cabinet Secretary giving way, and I genuinely know that the Cabinet Secretary wants to deploy technology in the way it can, but the reality is it's not happening. I mean, I had a look at the app that's being deployed in South Lanarkshire, and all that can be accessed is dermatology. We are miles behind. What is it that is preventing the Scottish Government from actually adopting technology in the first place?
Through the Chair, Cabinet Secretary.
It's the first iteration. That's the first pilot part of the NHS digital front door that's been operated not just in South Lanarkshire but the entirety of NHS Lanarkshire. And we will obviously be building a product that goes beyond what Mr Whittle has suggested for the reasons that he has outlined, which I share. I believe the framework can and will support staff to work more flexibly, collaboratively across teams, enabled through better access to the right digital tools which make their lives easier and the healthcare they deliver better. More of the care they deliver will be in the community, with hospitals' capacity targeted towards those with the most complex needs. And the Service Renewal Framework will provide a blueprint for delivery and mark a step change in the way we deliver healthcare. Presiding Officer, these frameworks represent a comprehensive package of reform, but they will only be successful if they have the support of this Parliament. And therefore, I want to use today's debate as an opportunity, as I will in the coming period, to restate my absolute commitment to working with colleagues across the Chamber to deliver the change which I believe we all want to see. Through collaboration and consensus, I believe that we can set the system on the path for success, and my door is always open to the ideas about how we can deliver that change in a way that is as inclusive and effective as possible, benefiting the entire Scottish population, including those staff who deliver services across our health and social care system. Indeed, to conclude, Presiding Officer, on the point in the motion that colleagues are concerned about around the Future Medical Workforce project that is due to report at the end of this year, I would like to extend an invitation to colleagues to participate in a cross-party panel to discuss the findings of it when it has reported and consider the onward reforms required, seeking to build consensus, showing our collective commitment to our NHS doctors in delivering real change and renewal.
Thank you. I now call on Paul Sweeney to wind up the debate around 6 minutes. Mr Sweeney.
Thank you, Deputy Presiding Officer, and it's a pleasure to close for Labour in today's debate. Having listened to the course of the debate, I'm not sure what the government's goal is here. It seems its instincts are to be defensive rather than recognise something that is an open scandal in our National Health Service. When discussing the issues with clinicians, doctors, junior doctors in particular, across Scotland, it is a recurring and persistent matter that is raised, and it doesn't seem like the tone of the debate, certainly from the government benches, has been remotely concerned with that reality, the lived experience of our constituents, our medical professionals. Yes, I'm happy to give way.
Cabinet Secretary.
Reflected on where I concluded my closing remarks, which was far from defensive, but was an opening to further talks and discussions as to how we can reflect upon these issues and build consensus. That's not defensive, that's opening and seeking to reach out to find consensus in a way forward.
Paul Sweeney.
Well, the issue is, of course, that's all well and good, but what we need is leadership from the Health Secretary in Scotland, not simply further commentary on this matter. And I take the point, and I will give the Health Secretary the benefit of the doubt in regards to that willingness to build consensus. But in response to my colleague Ms Lennon, for example, he claimed that there is a workforce plan. We've been calling for this for years. The reality is, even inspecting the government amendment, it's a commitment to develop future workforce planning in response to the forthcoming population health and service renewal frameworks, which will report on the planning dialogue alongside an analysis of workforce demand and supply by the end of this year. It doesn't feel that there's a sense of urgency in government. It doesn't feel there's a sense of grip, and that is why we are coming here today with this motion, which reflects a fairly scandalous comprise of data from BMA Scotland. 7 in 10 resident doctors responded to that survey concerned about possible unemployment. When surveyed on the issue of applying for specialty training successfully, most people haven't been able to get their desired job. Applied for specialty training unsuccessfully, 27%. Applying for clinical development new fellow roles, 34%. Applying for a locally employed doctor position, just 19% success. Planning to locum extensively 10% of our junior doctors, introducing even greater waste into the National Health Service. Applying for medical jobs abroad, 11%. 11% bleed rate overseas is not good enough, Health Secretary. I think there needs to be much greater effort to stem that flow. It's not an immigration crisis, actually, we have in terms of the NHS. It's an immigration crisis to Australia, and it's endemic. So all my peer group who are medical students at university are all in Australia or New Zealand right now, almost all of them. It's not just anecdotal. This is clearly met by the data. People are disappointed that they're not getting their opportunity to get their first choice training post, and they're going overseas whilst they can have the opportunity to do so before settling down. The competition ratios we've seen have only got worse over the last few years. The average is 5 to 1, chasing these specialty training posts. The disappointment rate is too much, and it's because these posts have flatlined whilst demand has increased. It feels like the plug is out the bath, and simply turning the tap on to a faster flow isn't going to solve that problem when you're not actually investing, Deputy Presiding Officer, in these specialty training posts. And the irony is that at the other end of the process, we're having an increasing outflow of consultancy positions. More and more consultants are looking to leave the NHS or reducing their hours. That's what we're hearing from the consultants. So at both ends of the system, there is an incoherence, and that is at the heart of the issue that we're having to face. And it's not just, of course, amongst the doctors, it's about the nurses as well, as was ably put by speakers in the debate. Not only have we got a huge vacancy issue in the NHS, we've got this vicious cycle of the dependency on agency nursing and the costs that introduces across the NHS. And of course, even within the inflow, the pressure on nursing students. I thought Mr Whittle made an excellent point about the opportunity of perhaps looking at direct paid training courses through an apprentice programme like we would have in the police or the armed forces, for example. Yes.
To the Cabinet Secretary.
The agency nursing spend in Scotland was down by 62% last year, or £94 million. Would you care to welcome that?
Paul Sweeney.
Well, certainly welcome any direction of travel improvement, but nonetheless it's still huge amounts of waste that we need to tackle vigorously. And that is a massive issue that we need to address. Also mentioned, of course, the issue of care home places as well, nursing shortages in care homes, the pressure then that places on the primary care and the secondary care in NHS. Yes, I have to give way.
Very briefly, Sanders Gohan.
I wonder if a member would agree with me that these pressures create moral injury which affects our staff who feel burnt out and then they just leave.
Paul Sweeney.
I think that was recognised across the chamber. This is a massive issue, but I don't think the government has certainly expressed the vigour we would want in addressing that. The sickness and absence rate across NHS Scotland has risen to 6.4%, but we know it's much higher in nursing in particular, with an absence rate in nursing of more than 7% across Scotland. I mean, to have that level of absenteeism across the NHS due to that moral injury, that burnout, that sense of hopelessness, not to mention the mental health impacts it has among staff, is atrocious. And of course, we mentioned, the inflow, the pressure on training. 66% of nursing students have considered dropping out due to the cost pressures. That is a massive waste of human potential and a massive waste of public resource. So we need to develop that workforce plan. The government has had 18 years incumbency to develop that plan. It's shocking, really, that they're only now getting around to proposing it. I'm afraid the time has run out. We're less than a year away from the next election. The point of getting together to work it out is past. The point of being held to account is now here. And I hope that the people of Scotland, the clinicians of Scotland, the people who work in our NHS every day, will hold this government to account for their abject failure in meeting the needs, not just of that workforce, but of the whole population of this country.
Thank you. That concludes the debate on addressing Scotland's medical and nursing workforce crisis.